respond to, you know, communicate with. And then also see if they have any stress reducing policies within your organization. Like Jennifer said, Atrium Health has the code lavender, and they used to have lavender Fridays where you could, like, in the break room, they would have you know, mindfulness or healing touch or massages or different things like that. There's three theoretical models that I have found that go along with stress: the Hans Selye stress theory, the stress diathesis model, and the Stewart stress adaptation. So the Hans Selye stress model was created by Hans Selye. He was a Hungarian endocrinologist. He was one of the first theorists to bring a scientific interpretation of stress, and how his theory goes off of the general adaptation syndrome. Basically, the general adaptation syndrome explains to us that body copes with stress through a system called your hypothalamic pituitary adrenal axis, or your HPA axis. So there's different, you know, hormones, adrenaline, different things like that, that how your body responds to stress. And in those hormones and there's 3 different stages your body goes through. So the first stage is your alarm stage. So this is your first encounter of stress, the fight or flight. Like Jennifer said, the bear, if you see a bear coming after you, this is when you would start to run in your alarm. Step 2 would be your resistance. This is where maybe the bear has diverted the path and you're still, you know, up in, you know, you're tightened up, you're aware of your surroundings, but your body is still on alert, but maybe not as alarmed because the bear's not right after you. And then exhaustion. If the bear never goes away, or if you never can stop thinking about the bear, then your body's going to forever be in this state of alarm and state of alertness, and your body will tire out. And this can pose a problem with the body because it will exhaust itself. The second model was your stress diathesis model. This was theorizing how predisposition and environmental stress can result in mental disorders. So diathesis is a person's predisposition or vulnerability to a medical condition. So either you have inherited this biological predisposition, your environmental stress is your predisposed, or a combination of both. So meaning that your stress is caused by what is around you, and if you do not take care of those stressful life events and learn how to cope with those, then you can eventually create a mental disorder like anxiety or PTSD or depression, because your body is in such an exhausted state because you are always stressed, and it can cause a mental disorder. The third model was your Stewart stress adaptation. This is implemented in many psychiatric nursing facilities, and this integrates the 5 elements of holistic care. So your biological, your psychological, your sociocultural, your environmental, and then your legal/ethical aspects of patient care. It breaks down this model into 4 stages. So your crisis stage, this is like the alert stage. This is when the stressor first happens. You don't have any coping mechanisms. You're stressed out. You're worried. Then you go into your second stage, which is your acute stage. The stressor is still present, but you're working on how to cope with it. You're finding your coping skills. You're finding what works and what doesn't to help you cope through this stressor. 3 is your maintenance stage. You found what works. You're maintaining what your coping skills. You're maintaining, you know, your lesser stressed life. And then 4 is your health promotion stage, which you're preventing the bad reactions, the bad coping skills from ever happening again, either on a primary, secondary, or tertiary level. All of these models can play into our like day-to-day lives, because we can see the Hans Selye stress adaptation by using the 3 steps of alarm, and then resistance, and then exhaustion. And then we can see the stress diathesis model, where we see how we cope with it. And if we are not coping with it properly, then we can obtain a mental disorder from our predisposition and stress within our life. And then our Stewart stress adaptation model, we can walk through the 4 stages. And then most of us is probably in the health promotion, you know, stage, where we know how to cope, or we found our ways that we cope with our stress differently. And we're learning on how to maintain and walk through our stressful lives with the stressful parts in our lives with the coping skills we know.
Okay. So now we're talking about the stress reduction recommendations from evidence-based practice. There's been a lot of research that's been done that signifies the importance of stress reduction in nursing care as well as other healthcare professions. So some of the evidence-based practice relates to mindfulness-based stress reduction. And this is actually where you use a technique that assumes a greater awareness of the here and now, and allows you to focus on the here and now and to alleviate the stress of what may come or what has been. Also, progressive muscle relaxation. The evidence with that is taking your mind off of the problem at hand and using each part of your body to relax yourself, which in turn engages a relaxed mind. Also, guided imagery is something that healthcare professionals as well as patients can use to sort of put you in a different place at a different time. It gives you a chance to create a scenario that is the mind finds pleasant so that the body can there follow. We spoke about lavender and the use of it during some of the wellness workshops that we've talked about. So lavender is used for aromatherapy to calm as a calming agent, and also used in massages. Another evidence-based practice was expressive arts, where you use either music, dance, or graphics to give yourself a chance to vent and give the mind an opportunity to express itself outside of just building up frustration. Another evidence-based practice was enhanced social support. And so this is indicative of like cognitive behavioral therapy, group therapy, as well as taking advantage of some of the like employee assistance programs where you can actually sit down and relate to someone the things that may be causing you undue stress. Workplace exercise interventions are also evidence-based practice. So the concept of Zumba or yoga in the workplace areas, even sometimes throughout the work day being available, has been shown to reduce or alleviate some of the stress that nurses or healthcare professionals may feel throughout the day. Next. So some of the conclusions that can be based on this evidence and some of the articles that we were able to find is that in order to achieve the goal of stress reduction, the objective must be, as we know in nursing, SMART. So SMART is being specific, measurable, attainable, realistic, and time-bound. We use this role consistently in providing objectives. So it's no difference in the role of managing stress. So based on the current evidence that we've discussed in the literature, the following can be concluded that in order for one to be successful at reducing their stress, these considerations must be made. Some we've already addressed, but one is being specific. What is stressful to one person may not be stressful to another. So each individual should be aware of their own personal triggers and situations that may for them constitute a stressful situation. You should be able to identify signals that your body gives off in regards to stress. As we talked about the HPA axis, some of the things as far as maybe increased sweating, tension, muscle tension, things of these natures are sort of a body's response to specific stressors that a person may be feeling. So the goal is to be proactive in reducing the stress versus reactive to an already out of control problem. Also, a part of the objective, it should be measurable. And this can be done in stress management because The reduction of stress has been shown to reduce blood pressure, lessen digestive issues, improve mood, it enhances immune function, reduces burnout, and it also may aid in weight loss by eliminating the need to stress eat, which is something that a lot of people do as a stress reducer that is not healthy. Again, with any objective, it should be attainable. So we've given a lot of guidelines and a lot of information that can achieve stress management and stress reduction. And some of these that we've mentioned are implementing activities that include exercise, engaging in a proper diet, and attempting to get quality rest, which we know for healthcare professionals can sometimes be a challenge. Also, meditation and a work-life balance is a part of the lifestyle adjustments that's necessary to be successful at managing one's stress or the reduction of stress. Again, with any objective, it should be realistic. Stress, we know, will happen in life. There's nothing that we can do about it. However, if we know our limitations, then we may be able to avoid certain situations, perhaps having to say no to additional duties or events. Stress reduction generally comes when you change things that you can change, you accept the things that you can't change, and you be realistic enough to know the difference. Lastly, we talk about time. Time management, timeliness is crucial in the success of managing stress. It requires you to be aware of your time by making plans for self-care, being in preparation for activities ahead of time. Preparation can eliminate stress by being forcing you to not to take on tasks that will make you multitask. It also helps you to prevent procrastination. Procrastination can add to stress and create anxiety. A part of stress reduction is eliminating worries regarding the past or the future. And as we spoke about earlier, it is a sense of being in the present moment and focusing your time on just what is at hand and what is now. Next. Some questions for consideration that we have is further research. How do we increase nursing staff so that shortages are not as proficient in the atmosphere and will allow for more time off for nurses to achieve self-care? Part of the consideration should be including more nursing instructors, which can increase the admission into nursing schools. The more people we have going through nursing school, of course, we'll then end up with more nurses in the field, which will reduce the patient to nurse ratio. Also, considerations can be improving charting systems so that less time at the computer gives nurses more time with patient care. It will also help with some of the ergonomic issues that create stress points in the body. Also, an increased number of healthcare partners to assist with tasks, maybe widening our interdisciplinary team to be able to delegate more activities to others. Also, incentive programs that can increase nursing education and allow nurses to take ownership in their profession. All of these things are questions for consideration that may lead to stress reduction in the future for nurses.
And here's
Next.
Here's our references. Okay.